See, Medanta has organized this, what we call the International Coronary Congress 2016. The idea behind this Congress is to break the mold, where normally cardiologists have their own conferences, surgeons have their own conferences, and there is no common ground on which they work for the benefit of the patient, because the patient actually may require one or the other, and there may be some doubts about one or the other. So, to optimize the actual delivery of coronary care to the patient, to the benefit of the patient, we said, let's create that same platform in which we then debate with each other what are the benefits for the patient for different modalities that are available today. So, we have medical therapy, we have the stents that are available that can open blocked arteries, and then we have the standard gold standard of coronary bypass surgery. So, if we take a patient and then study the patient according to the evidence available to us by different trials around the world, and we sit together and work for the benefit of the patient, that would be the ideal thing for us as deliverers of care or experts in coronary artery disease to give the best honest way treatment to the patient, and also the patient would have the full satisfaction that if we have distilled all his particular information, put it in perspective, and then decided what's the best for him as a debate between the clinical cardiologist, the interventional cardiologist, and the surgeon. So, to simplify it, we have named it the heart team. So, the theme of this conference is heart team, means that there are certain patients who are clearly benefit from medical therapy, applying all the modern technology available to ascertain that they will be safe on medical therapy. The second is that there have been huge advancements in assessing the degree of blockage in the arteries and the outcome of the arteries. So, all this new technology has to be shared with each other. So, in the sense you can measure what the velocity of the blood flowing through the artery is. So, there are many tests available. Once we have the score, we translate all the factors of a patient into a score, what we call syntax score. In that, we know if a patient falls in a different category, then they may benefit from stenting, and if they fall in the other category, they will fall into the surgical group, in the sense that long term, short term, and complete blood supply will come from which modality. And there are some cases where we combine the modalities, which we call hybrid operation, where we will take the more difficult vessels which cannot be angioplastied with surgery, and then some of the minor ones with stenting. So, there are, by this debate that is happening, by the end of the 2 days, that on Sunday, we will have a consensus that what should be the approach for what do we want to do. We want the safety of the patient, we want to relieve him of his symptoms, and we want to ensure that his risk of life to life is mitigated by our treatments for long periods of time. So, with achieving that goal from the patient's point of view, when we sit in a heart team, we fill out a form in front of the patient, we discuss the whole thing, and the patient also has to give their inputs of what they prefer after we have given them our common consensus, and then we all sign the form, which is known as the heart team form, and that is the most transparent way of actually practicing medicine. This is not prevalent in India. We have started it at Medanta over a year ago. We do it regularly, and I thought that it's a good thing to set that standard for India, where patients are often in doubt, or even the doctors are in doubt what's the best thing for the patient. So, this is what we have to achieve from this conference, and we have 28 international leaders of different aspects of cardiology, cardiac surgery, interventionalists, and 128 Indian faculty. So, we have them intensely debating through these 3 days, and hopefully everybody will benefit, and that's the purpose of International Congress 2016 organized by Medanta.